Hello, welcome, welcome. A little bit of silence there. I had myself muted. Welcome. Let me get the phone line recording going. Welcome to the Life Breath Club's weekly meeting for June 2nd. Hang on just a minute.
Conference recording started.
Okay, welcome. Welcome to the Life Breath Club's weekly meeting for June 2nd, 2014. This is Carrie Tucker, the Life Breath Coach from HeartFailureSolutions.com. This weekly meeting is a commitment to spend 60 minutes once a week focused on your breathing. Breathing into now, breathing into this present moment is how we receive insights into the best course of action. How your immediate action steps are revealed to you when you breathe into now. What is up, Nicholas?
Great. Alan, never.
Yeah, I know. She's sick, sweetheart. I'll clean it up afterwards. She's here with me. She's fine with me for now. I will address her mess she made when I'm done with the call. I'm concerned about her too. Thanks, Nick. His big sister's puppy is not well, and we're sure hoping that she's going to pull through. So we're giving her lots of loving care. Nick wanted to express his concern for an accident that she had in the hallway. I noticed that, but I'll have to clean it up after the call. Poor little girl. We're hoping that Gracie, the puppy dog, feels a whole lot better. I'll give you an update next week, and hopefully it's good news. So I hope you got water nearby that you can sip on. Perhaps a nice cup of tea, if that sounds good to you. This week on our Life Breath Club weekly meeting, we'll definitely be breathing into now a bit. In a minute here, I think I'll invite you all to join me as we find our center and encourage a straight spine and check out our breathing for a minute. Aileen Bounty has been wonderful in offering to guide us on meditative journeys. In the future, we'll be putting together awesome, wonderful recordings. Aileen has a gift for guiding us to that healing space within. She knows how to get us there, and I'm excited to really embrace her guidance here. Our Life Breath Club advisors are so important to the process, and if you have expertise that you would like to contribute, please speak up. We really do value what you bring to the Health Mastermind that meets each Monday, same time, same place, where the Life Breath Club members let each other know that we care and we are here to help you brainstorm solution. Now, your solution is waiting to be discovered. So often, what we think we need to address, what the problem, the symptom, the discomfort that we feel we need to attend to, is actually not the highest priority. And as your body begins to heal, recover, even if that's just simply getting more sleep, then the higher priority need will begin to become apparent. It will present itself to you. So often, getting a little more sleep makes you more tired. You feel like it's made things worse instead of better. But I encourage you, increase your oxygen, that free ebook from the Life Breath Coach that you can access by becoming a member of the Life Breath of the Life Breath Club. They're on HeartFailureSolutions.com. Just give us your name and email address, and you'll be able to log in and download your free copy of Increase Your Oxygen, the free ebook from the Life Breath Coach that really begins to address your role in creating abundant health in your life. When you really understand how disease presents itself and how it progresses, you can really begin to understand that you are more powerful than you know. Just instant messaging a couple Life Breath Club members that are contacting me. We had a new dial-in number to the telephone call. I gather that is what's causing the confusion. Let me make sure they've got the PIN. So hopefully they can make it on into the phone line. Otherwise, you can access this call live in the live streaming audio on the membership area, in the membership area of the Heart Failure Solutions blog. Or once the call's over, that recording will remain there and available for you to access at any time you'd like to do that. I will try and be a little more sensitive to watching for questions on the blog as well as Google+. Remember, you have to have a Google Plus account in order to comment on the Heart Failure Solutions blog. We had such a problem with spammers, yeah, just bombing the site with attempting to place comments. Even when our software has identified them and prevented them from posting, they're still eating up lots of bandwidth. The place we live, yeah, our virtual address there at heartfailuresolutions.com lives on a server, and when those spammers hound us, the server is overburdened with the traffic coming from these spammers. It really causes a problem. It makes it difficult for us to remain sustainable. Yeah, if I need to pay for hundreds of dollars per month in bandwidth fees in order to present that virtual address there for you to access the Life Breath Club there online anytime, day or night, that you need support, then I need to minimize that drain on our resources, and that is why we disabled WordPress comments. So you can't just comment on the blog like you might have become used to over the past 5-6 years. That and it's so common on so many other blogs. But if you'll notice that over on YouTube, they are wanting you to comment with your Google Plus membership as well. So you know it's a fix that many sites are turning to. Right? When there's lots of traffic finding their way to your virtual address, you've got to do something to make things sane, or things get crazy and you fold. You close your doors. Yeah, that virtual address seems free, but there's actually some cost in maintaining that space so that we can be there to give you the support that you need when you find us. So please do feel welcome to just go to google.com, right, and sign up, start a membership. You can gain access to Google Drive, where you can store important documents that you want to share with other people, or that you just want to keep safe in case your system crashes, right? It's a backup of sorts, and it's free. Anybody can have a Google account. You can have a Gmail account along with your Google Drive account. You can have a Google Calendar that can be on your phone, and it can keep track of all of your appointments. So a Google account's very useful to have. And it also enables you to place your comments and discussion, your celebration, that we can help you cheer you on, right there on the Heart Failure Solutions blog with your Google Plus account. Okay, Chris still having some trouble. Let me see if I can help him. It's not a good feeling to be trying to enter into a space where you hope to get support and you hope to feel camaraderie, and to be locked out. So please do bear with me while I pause to type so that I can address those folks waiting on the other side of the door there. We don't want to lock them out. And like I say, though, I'll remind you all that you can access the recording. Oh, well, doggone. Well, I wonder why. He says he'll call in again. He says he's on the line and not accessing the call. So if you'll notice that the phone number I gave you is wrong. They've evidently changed it without notice. I did not get a notice that the dial-in phone number would be changing, but when I called in to get on the line myself today, I was informed that the line had indeed changed. So hopefully others can make it into the call. If not, That's why we're alone here, I gather. I'm getting lots of chatting from folks really wanting to participate on the phone. I'm looking forward to getting the Google Plus, the Google Hangout ability to welcome you all to come on in and join me on that Hangout. Yeah, your beautiful shining faces will show up with your webcam, as will mine. I'm really ready to do that. Today on the call, I have consulted with my heart and decided that we will discuss pain, depression, and heart failure today. Yes? So in other words, how do pain and depression contribute to heart failure? Yeah? Both physical pain as well as emotional pain are significant contributors to both depression and heart failure. Yeah, you'll agree with that, I'm sure. If not, please do speak up. The lines are unmuted when anyone can make them on. And you can comment in the comment area on the post that shares the live stream on the Heart Failure Solutions blog. If you sign in, you find it in the members area under Life Breath Club Archive. I put them up there, archive them when they're live from the beginning, just to cut down on the workload that's required to share those with you. But you can definitely comment there. You can comment on Google Plus, and you can dial in and speak up live because the lines are not muted. And we're just alone today because no one can get here. Okay, we laugh it off and we accept what is. Shoot, yeah, Chris is still on hold. Let him know. Okay, just letting Chris know that he is calling in and ending up on hold again and again. So I just let him know that you can access the call in the members area, and I'm almost tempted to start up an instant teleseminar account again, but maybe we'll just figure out the Google Plus Hangout and that program and see if we can make it more useful. But I really don't like having people locked out. It really is heavy on my heart. We are a community, and we embrace each other. We honor that we spend an hour to come together and to focus our awareness on our breath. And we don't want you to be unable to find your way here. So that makes me sad. That really weighs heavy on my heart. So please do accept my apology. Okay, and Chris is going to go ahead and navigate his way over to the recording that's on the membership area, and I will definitely refresh that screen and be sensitive to comments coming in over there in the membership area. So, back to our subject of the day. You are important. The 60 minutes of commitment to focus on your breathing each week is important. Why? Because you will become habitually more aware of your breathing day in and day out. Why is that important? Well, Life Breath Clubbers know that breathing into now, one, can save your life, right? Can save you from a stroke, a heart attack, within this present moment. Slowing your breathing with a straight spine, allowing your diaphragm to climb up as you exhale. And when you wait on that deepest parasympathetic breathing, right? You have sympathetic breathing, which is fight or flight. You have parasympathetic breathing, which is that more relaxing, healing nervous system response that allows you to breathe into your lungs much more deeply than you are able to when you do it deliberately. Right? You take a breath. You just cannot breathe as deeply as you do when you exhale, hold, allow for complete exhale, wait, just wait for that breath. And when it comes, you didn't do it, right? Your deepest nervous system, your parasympathetic nervous system, is responsible for initiating that breath. That's why it was so deep and so cleansing, right? And when you can allow that shift in your nervous system to a more healing and restorative breathing, you receive insights, you receive awareness as to your solution, right? And within the moment, slowing your breath, slowing that exhale and waiting on that inhale, it causes a shift in your biochemistry. This shift in your biochemistry makes oxygen more available to the cells, tissues, and organ systems in your body. All those vital organs are being well oxygenated when you make oxygen more available by coaxing a healthier carbon dioxide level, right? That slowed exhale followed by waiting for the inhale. Life Breath Club member Chris Downs says he's made his way to the membership area on the blog. Awesome. And Chris really found that difficult to slowly exhale and wait on the inhale until he was able to utilize that simple, silly little exercise that he calls it the Chihuahua head bob. So the Taco Bell Chihuahua in the commercials, how he bobs his head, up and down. That yes, that very big yes, that yes nod is something that we have really found to be incredibly powerful. Many of the members here on the Life Breath Club. Chris Downs really found it quickly useful. Yeah. It helps to open your nose so that you can breathe through your nose instead of your mouth. Breathing through your nose instead of your mouth slows your breathing all by itself and can help to coax this more healthy biochemical shift by slowing your breathing. Sometimes that causes distress and you feel forced to open your mouth to gulp in a breath and feel some relief. But what we really begin to understand is that coaxing this slower respiration, coaxing this relaxed nervous system response, right, allows for this biochemical shift that creates an anti-inflammatory effort, right? That inflammation decreases in our airways, in our central nervous system, in our heart. Yeah, throughout our body we get this wave of anti-inflammatory effort. Yeah, because carbon dioxide causes this decrease in inflammation. We think of carbon dioxide as a bad thing, especially if you're a lung patient, right? A chronic obstructive pulmonary disease or emphysema or pulmonary fibrosis or so many of the lung diseases that our Life Breath Club members are living with, that we think of carbon dioxide as a bad thing, that when that increases, we're in trouble. That's why it's hard to wrap your brain around what we're saying here on the Life Breath Club, that welcome this slowed respiration, welcome this savoring of carbon dioxide, that it's actually a good thing. Yeah? Breathing faster won't get more oxygen into your body. Yeah? Wait a minute, say what? Yeah, weird, isn't it? So breathing slower gets more oxygen into our body, because we shift the oxyhemoglobin dissociation curve, right? So the dissociation that happens between oxygen and your blood is caused by this dissociation curve. It's all based on pH. Yeah, the pH of your blood, the acid-base balance of your blood. Slowing your breathing allows this shift in the acid-base balance, and when that occurs, oxygen just leaps off your hemoglobin and directly to wherever it's needed, right? To every cell, every tissue, every organ, yeah, nourishing your organ systems with this enriched oxygen content. Right? This happens biochemically. Yeah, it seems counterproductive there when you're thinking about it. You breathe faster isn't something we think about, right? We just do it out of this desperate urge for more air. So the beginning of breathing into now, yeah, that accepting place that we arrive at that allows that, right, is this place where we embrace air hunger. Air hunger feels bad. Feels like no, 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 bad, bad, bad. Yeah? So when you feel air hunger, try to relax. Try to say, oh yeah, okay, I'm supposed to remain calm in the face of the fear that is caused by air hunger. Shoot, panic, right? Downright panic is caused by this feeling of air hunger. Right? And when we can remember, okay, air hunger isn't necessarily bad. As we embrace this air hunger. We're feeling air hunger because we don't have adequate supply of oxygen in our blood. Right? So breathing faster feels like the thing to do, but as we relax, I've got more emails coming in from folks trying to join us. So please do bear with me. I just can't leave them waiting out there going, what's going on? How come I can't get in? Am I not an honored Life Breath Club member anymore? Oh, no, you are definitely an honored member. So very honored. Yeah, we definitely don't want to lock you out. So please bear with me as I give people some love and let them know what's going on. Just letting people know I will definitely listen, look for questions on the live stream in the members area. I really love it when we can include you and really take your questions so that I'm not just talking at you. Don't want to do that. Yeah. You know, as well, you know, we're talking about pain and depression and heart failure. So pain can cause us to breathe more shallow with our breathing if it hurts to breathe deeply. Pain can make us move less because it just hurts to move, right? Pain is depressing, right? Even if the cause of depression isn't pain, perhaps it's emotional distress. Perhaps it's just plain grief. Right? Grief is emotional distress, I suppose, initially, right? When we find out about news that brings upon grief, it is emotional distress. Yeah, it's shocking even. It grips our heart, yeah? But as we allow time to heal, sometimes we feel like just stuffing that is the best way to deal with it, yeah? It's painful if we focus on it, so we stuff it down as best we can and try our best to ignore it. Forget about it, right? Perhaps there's unforgiveness that we have, that we just feel at a loss. We're unable to forgive, so we stuff it down, right? Suppressing emotion causes depression all by itself, right? Because if you need to stuff bad emotion, if you feel the need to stuff bad emotion, then it's great to become aware that you're also stuffing good emotion. Now, you can't feel joy if you're unwilling to feel pain, both emotional as well as physical. What are you looking for, sweetheart? You know what? I saw it. Oh, it's in Brianna's room, probably on that table. Look in that little portable table. She used the nebulizer with hydrogen peroxide last night. Perhaps it's on that table. Summer vacation has begun. Nick gets a whole lot better about not interrupting Life Breath Club's weekly meeting. But I really hate to ignore him and shoo him out the door. So please do bear with me while Nick becomes accustomed to this 1 hour of devotion each week. He's been an awesome little trooper since he was 3 years old at really allowing this meeting space. And he'll get back on board with us, I trust. He's an awesome little guy and really supporting of our meeting place each week. So, he was looking for his wallet, so hopefully I pointed him in the right direction. He had $1 to tuck in it. He must have earned some allowance for a chore he did with his father. That's normally where dollars appear from in Nick's pocket. So It's awesome to be able to honor folks wherever they're at, right, in their learning curve. Nick's been warned, but hey, we'll be flexible and gentle with him while he remembers, oh yeah, I'm not supposed to interrupt. So our grief, we think that stuffing down that grief keeps that grief from interrupting our life and our happiness. We don't want grief to interrupt other people's comfort and happiness, right? And it just feels rude sometimes. Sometimes folks will ask you, please put that grief in a box and be done with it. Yeah, just leave it alone, right? Likely because it hurts them, right? Likely because your grief touches a very painful place for them. I'm sure you may have experienced this. If you have been wrestling with grief and just been held in the grip of grief, you may have been encouraged to stuff it, right, by the people around you. And you saw their pain and you didn't want to make them suffer. So you obliged that. And you said, okay, I promise I won't make you hurt anymore. Okay? I have a friend who, you can tell when it's her mother's birthday, her father's birthday, or her sister's birthday, because she will have a glass of wine in her hand. She's not much of a drinker, but on those days, a birthday or an anniversary of their death, she lost her 3 beloved family members in quick succession, and their birthdays and the anniversary of their death are dates which cause her pain. So I know she feels that she stuffs the pain and gets on with life as best she can, but you can see it and its effect in her life. Okay? So instead of reaching for a glass of wine, maybe going to the cemetery or calling up someone you know who has lost someone dear to them, who you know can relate to your pain. Who knows? What is it that you can do to allow for this painful emotion, right? Because allowing pain is a way to prevent heart failure. It's a way to prevent depression, right? It feels like we're doing the opposite when we allow grief, when we allow emotional disturbance, right? If we're angry, right? It feels like suppressing that anger or grief is actually preventing depression. But the opposite is true, right? You cannot deny an emotion. Allow an expression as best you can. Certainly you have no right to hurt someone with anger. But denying your anger won't free you of it. Right? So allowing it expression is a remedy for depression and for heart failure. So depression causes heart failure by inhibiting your ability to be active. Now, sedentary death syndrome causes you to die prematurely of absolutely every single cause of death. Whatever's wrong with you, finding a way to be as active as possible is the best possible course of action within each day. Yeah. If it's too painful to move, if you can't get up and walk, can you move your arms? Can you just get up, stand next to something, and bounce? Sounds ridiculous and a worthless waste of time, but it's actually an incredibly powerful way to coax yourself into forward motion. Right? Pain also causes this lack of activity. Yeah, this sedentary, increasingly sedentary lifestyle. Right? So sometimes medicating pain will allow you to be more active and thereby reduce your risk of developing heart failure. Right? Heart disease is killing us more than everything else combined. We talk here on the Life Breath Club a lot about how heart disease is a disease of the circulating blood. Yeah, it is not a plumbing problem. You don't need to be roto-rootered or replumbed. You simply need to clean up your sticky, gummy, dirty blood. Right? And becoming active, becoming a little more active than you have been, and allowing as much of an increase as you can possibly manage, and doing it with fun really helps you do more of it. Right? If it's painful, you're more likely to resist it. Right? But becoming more active is actually restorative. Yeah? It will actually help to lessen your pain, lessen your depression. Psychotropics really are mind-altering drugs, right? Zoloft, Paxil, all those. Yeah? And we say, hey, I need these. These are life-sustaining for me. Well, and sometimes it can be that shift to get you out of that dark well so that you just don't fade away into obscurity, into invisibility, into complete lack of activity, right? So they can get you out of the well where you can see the light of day and reach out and ask for help, right? But I hope that your doctor's been careful to point out that they also increase suicidal feelings. Shoot, it increase homicidal feelings as well, God forbid. Now, this is drug-induced. Yet you might not be aware. Oh, this feeling I'm having is caused by my prescription medication, right? It won't be obvious. These drugs are contraindicated in young people. Now, teenagers have much more side effect from these drugs than do adults that are beyond that hormonal fluctuation that occurs within teenage years, right? So much so that they have become contraindicated, right? By the physician's desk reference tells healthcare providers that it's very dangerous to give these drugs to children who fall into that category. Yet they still do it, right? They say that the emotional trauma, the emotional disturbance is more dangerous than is the psychotropic medication. Well, that's arguable since we are facing an epidemic of suicide along with our epidemic of heart disease. Right? What I was getting to there with our gummy, sticky, dirty blood, we think heart disease is heart attack, that people die of a heart attack. I've heard so many folks say, oh, I already defeated heart disease. I had a heart attack and it didn't kill me because heart disease can't kill me. Well, that's absurd, right? Because more and more, we're not dying of heart attacks. We're dying of heart failure. And heart failure is something that can go undiagnosed for, shoot, a decade. Yeah? It can be called a lot of things. Asthma, lung disease. It can be overlooked completely until you're hospitalized in an intensive care setting with acute heart failure. There's no ignoring, there's no misdiagnosing acute heart failure, where your heart is not pumping enough blood for you to survive. But up until you are in full-blown acute heart failure, it's very easy to miss it. So many healthcare professionals, doctors, nurses, nurse practitioners, physician's assistants, they tell me, heart failure is easy to diagnose. Well, I beg to differ. The CDC says it goes undiagnosed in epidemic proportions. That's why heart failure is increasingly destructive, because it goes unaddressed for so very long. However, when heart failure is addressed early on, it is typically addressed with drugging. Right? We don't really address the fact that activity is very important for preventing the rapid progression of heart failure. And yet so many of the clients that I speak to feel like this pointing to, this alluding to heart issue means they shouldn't exercise, quote unquote, exercise. Well, arguably you shouldn't push yourself, but you need activity. And doctors really are not addressing this with their patients. If they do, it's in passing, and patients aren't grabbing hold of it and receiving that message. And Dr. Julian Whitaker says that the drugs to treat heart failure are contributing to the demise of those suffering with heart failure. So Chris, you're saying that I did believe that death was an option at the time. So I'm fond of saying death is a valid choice. And what I mean by that is that if you smoke cigarettes and you're not willing to quit, that's your choice. Yes, it's contributing to your dis-ease. It's contributing to the progression of heart failure. And that's your choice, because death is a valid choice. Saying you cannot exercise, you cannot move, it's too uncomfortable, you're too short of breath, is a valid choice, because death is a valid choice. But sit down in your lazy boy and refuse to move and let your family wait on you hand and foot is choosing death. Right? Depression, getting in bed, covering your head with the covers and staying there is choosing death. Right? If a prescription medication helps you get out of that bed, get out the door and down the road, walk, get out there, talk to people, share your story, right? So much of telling your story is about reclaiming what you lost. It's about reclaiming your dignity, right? Grief is about reclaiming the happy memories of the loved one who is not with us any longer, right? Forgiveness is about telling the story with all its detail so that you can reclaim your dignity and step back into wholeness, so that you can love yourself, right? Because forgiveness is a gift you give yourself, right? So much of this has everything to do with pain and depression, right? So emotional processing is important. So right now, I promised you we were going to take a little exercise together. Let's talk about breathing into now. Aileen is gifted at this. She tells us to focus on our breathing. She says, don't do anything with it, just notice it. Is it rhythmic and smooth, or is it short and jerking? Yeah, don't change it. It's hard not to when you put your awareness on your breathing, isn't it? To count the number of times you breathe in a minute is pretty near impossible. You almost need someone else to do it, because as soon as you focus on your breathing, it changes. Yeah? Someone else can tell you what you're doing, but as soon as you attempt to time it, count it, analyze it, it changes. Likely becomes more tight, more stiff. That's why sacred breathing is about just allowing, observing. I love Dr. Ali's feather breathing. Something we like to point to help us find our way back to sacred breathing. Dr. Ali is fond of saying that you can't think your way to better breathing. You can't schedule it and force it, control it. You must receive it. But Dr. Ali does also encourage us to notice our breathing, and as we exhale, to exhale and hold, and exhale and hold, and allow for a more complete exhale. Allow for more rise in your diaphragm. I like that Dr. Ali also points out that this rise and fall of your diaphragm massages your heart. I love the way he puts it, is that this massaging of your heart, that happens with the rise and fall of your diaphragm, is the solution to the shenanigans of the heart, as he puts it. So a fussy, twitchy heart can be massaged and relaxed by focusing on this exhale, hold, exhale, hold, exhale, hold, that allows your diaphragm, which is a thick muscle that cuts you right in two at the bottom of your abdominal or your thoracic cavity there, the top of your abdominal cavity, right? It splits those two cavities up. Yeah? And as that diaphragm. If your diaphragm is very weak, it's paper thin. As your diaphragm gains strength, it grows thicker. And as this diaphragm climbs higher up your spinal column, and we wait for that inhale, it falls much farther down your spinal column because your relaxed breathing has enabled it to, right? Then the massaging motion gets bigger, gets more therapeutic, right? And it can ease those shenanigans, stop that twitchy heart, right? So as we focus on our breathing, take a look. Where's your head? Is your head hanging off the front? Or is your head balanced on top of your spine? If you have a real rounding in your shoulders, that can feel pretty awkward. It's all right. It's okay. Awkward's good. Awkward's progress. Awkward gives you something to notice. Right? So, are you all tense and bunched up right there in your chest? Or have you relaxed and allowed this settling into the bowl of muscle that's at the bottom of you? Right? No sway back, right? The bowl is equally out in the back as the bowl is out in the front. Don't suck your tummy in. Yeah, that squeezes your guts and pushes them up into your lungs, right? So we're not trying to suck in our belly or sway our back, right? We want the opposite. We want to allow that bowl of muscle at the bottom of us. And as your strength grows and your exhalation grows, you'll really begin to become aware of how much more relaxed your inhale feels. So, whenever you give your attention to your breathing, you're wanting to just notice without changing anything at first. And then take a look at your spine, right? Are you hunched or are you coaxing a straighter spine? Right? I love the tips from our wonderful shared resources. And I'll do some work this week if my energy levels remain constant this week. I've had some setbacks in my challenges with addressing the infection in my inner ear. The ear, nose, throat specialist wasn't very helpful, and I know a lot of you have found that. Yeah, you've counted down the days to a doctor's appointment and hoped that this would bring answers, and it brought nothing but disappointment and felt like a brick wall. So many of you have given up. I said, well, there's nothing I can do. But so many of you have also stayed right there in that peaceful, calm, centered space, kept giving your attention back to the breath, that sacred breathing. Yeah, you stayed present and aware and watchful. And solution you didn't know was available appeared. Yeah, became present. When you felt resistant to looking for a new doctor, gradually you became more open to looking for a new doctor. Right? For me, it's an acceptance that perhaps my APRN is enough. Perhaps because she listens and she has accompanied me on my journey so far and saw a lot of improvement in this ear that's been a chronic issue for me. She knows that we're making progress. She can celebrate that progress with me. She can acknowledge that what we're doing is working. Right? Unfortunately, the ear, nose, throat specialist came in after we had made a lot of progress. So much so, he felt there was no need for concern. Right? Well, my APRN, my nurse practitioner, she really understands something's going on here, and it wasn't being remedied by doing nothing. Yeah, because she had to encourage me to begin to flush the ear, put drops in the ear, begin to work with that ear, because I was opposed to putting anything in the ear because I had been told from the time I was very small to never allow moisture fluid into that ear. So I was very resistant. So she knows all that. The ear, nose, throat specialist didn't know that. He assumes that I haven't been careful to keep water out of the ear, and that all I need to do is be careful to keep water out of that ear. And telling him I'm very careful didn't help. Telling him I never use Q-tips, swabs to clean my ear, I guess he didn't believe. Telling him I haven't been in the water to swim, I live in Hawaii, for 5 years, I guess he didn't believe that. So it's hard when, I mean, your healthcare team really isn't listening when they're telling you they don't believe you. So enlisting that particular ear, nose, throat specialist is probably not a wise decision unless he really comes around and he really begins to look at my medical history. He really begins to engage in conversation with my nurse practitioner. Perhaps he doesn't respect my nurse practitioner the way he would a doctor. Yet I haven't found a doctor who listens the way my nurse practitioner does. So, so I'm right there with you guys. It can be frustrating to navigate finding the help you need. Yeah? Depression is likely going to be met with an offer for a psychotropic, a drug, to eliminate the depression. Yeah? Psychotropics for me in my lifelong battle with depression did not help. I felt paranoid. I felt an increase in my emotional distress. And my healthcare team was even reluctant to even back off of that drugging regimen. But I knew that there was a lot to be concerned about. So I backed away from that drugging effort. And I gave my attention to nutrition. It was very helpful. I gave my attention to activity and exercise. It was very helpful. Here, oh gosh, I guess we're 25 years into my healing journey from the pain of autoimmune symptoms, from depression that keeps you in bed with the covers over your head, right? Yeah. That makes getting out and walking out the door and down the road feels impossible, right? It's been a real lifelong battle for me. I found that emotional freedom technique, tapping, was very useful to get the emotional turmoil out of the way so that I could get up, put my shoes on, open the door, and walk. Just getting that far was huge. Yeah. I began to see things from a new perspective. I began to find solution that wasn't there before. Well, maybe it was, I just didn't see it. Right? But where I have come at this point in my life is that processing emotion I'm unwilling to process is necessary. Right? That drugs, activity, food can't help me if I insist on swallowing the emotion that requires expression. So emotional freedom technique is a tapping technique where just start by karate chopping one hand on top of the other and saying, I love and accept myself completely, right? Whether you're in physical pain, whether you're in emotional distress, sadness, anger, frustration, whatever it is, that you love and accept yourself completely anyway, even though the pain is excruciating or the anger is annoying, right? Whatever it is. Then you begin to tap and breathe. Don't hold your breath. Tap on top of your head with your fingers. I have a redirect link, heartfailuresolutions.com/tapping-points. And if you scroll down to the bottom of that page, you'll see Dr. Mercola showing you how and where to tap. He uses all of his fingers. Many coaches show you to use 1 or 2 fingers and tap on the specific point and where it's at. I love the way Dr. Mercola shows us, take all your fingers and tap in the general area. Shoot, you'll feel it. You'll feel that specific area that wants to be tapped on by tapping in the general area. So start with the top of your head, then go to your forehead, breathing. I like to say it's okay. Yeah, whatever it is, pain, emotional distress, whatever. I accept myself completely, so it's all good. It's okay. Then I tap on my temple area. Then I tap in, this may be slightly different than what Dr. Mercola is showing you. I've learned from many, many tapping teachers, and I'm finding, don't worry that you're doing it wrong. Just tap. And don't tap lightly, but don't hurt yourself, right? Back off if it hurts. Tap harder if you feel like you're not getting anywhere. Okay, so we move on to eyebrows. I like to take all my fingers and just tap from one end of my eyebrow to the other. I always feel a release when I do this. Then I tap with one finger the very inside of my brow. The top little notch there, you'll feel a little notch. Ouch! That usually hurts for me. And I tap there in the top middle arch in the brow. Then I tap on the outside of the brow. I usually spend some time at the outside point of my eye, and then I tap underneath my eye at that cheekbone notch. That one's easy to feel. And then I'll tap a little bit right there at the inside intersection of my eyelid. And I do that on both sides. If you're using two hands, you can do them both at once. And just tap and breathe. You'll see that many teachers have a much more complicated way of explaining this process. I find simple works best for me. After I've tapped well around my eyes, I tap out that pressure point on my cheekbones, underneath the center of my eye. Allow the release. That's a biggie for me. Then I'm tapping my upper lip, right between my lip and my nose. Can you feel that pressure point? Then I tap that cleft in my chin. Yeah, between the lip and the chin there, you feel where that crease is in your chin. Just tap there and breathe. It's okay. Then I just take my hand and I clap it on the top of my chest. You might have seen, my grandma used to do this all the time. When she was upset about something, sad emotions, she'd do this. When she would gaze upon her grandchildren, oh my, so precious, she'd tap there. When I learned emotional freedom technique and the tapping points, I thought of my grandma when we got to this point. But just, you know how you want to pat yourself there on the chest. That's why you feel that need. It's a very powerful therapeutic thing to do. Then we want to tap on our clavicular notch. So right down from your clavicle notch there, you'll feel a pressure point. Above your nipple, between your nipple and your clavicle, you'll feel that pressure point on each side. You just want to tap there. Ouch! That one's often tender for me as well. And you're breathing. And then you want to tap underneath. So it's still on your ribs, but it's underneath your breast there, in alignment with your nipple as well. There. Underneath the breast is the next tapping point. That one gets really sore for me at times as well. Just tap and breathe. Then I cross my arms and I tap that pressure point that's right midline. If you were to cut your body into front and back, right? Then that seam there under your armpit is where your pressure point is. And just, if you can't find it, tap up and down your side. You'll find it. It's a very definite spot where you'll find that pressure point that likes to be tapped to release every trapped emotion within. And that really completes the sequence. I generally tap my wrists together because I had one teacher who taught me that that's a way to cement in that release, right? I don't want to suck anything back in there. Just allow it to be released. One time through may feel like a waste of time to you. If so, please give it at least 3 rounds. Yeah, at least 3. If it starts to help at 3, go for 5. So all you're doing is breathing and tapping, right? If you're at the bank or you're sitting in your car in traffic and you feel too self-conscious to do it because people might be looking at you, I encourage you to try this same technique with just tapping on your nail beds. So take 2 fingers from your opposite hand and tap them on the inside of your nail beds. So if you're praying, that's the side of your nail beds that's facing you. So tap on thumb, pointer, index, ring, pinky, right? And you're breathing just like you would be as you work your way through the tapping points on your body. And yes, it's just as powerful as tapping on all those pressure points I just mentioned. If you feel hot in your hands, remember that the wrists are a real gateway to emotional energy. So maybe you need to tap just a bit harder, but you will cause a release. So releasing emotion allows for that deeper inhale when you've allowed your parasympathetic nervous system to take a good deep breath in there. Right? It can also get you out of that bed of depression, right? Help you get your shoes on and out the door before you change your mind. Yeah? Release the emotions that keep you stuck and new possibility presents itself. Right? Medicating with pain meds, yeah? So pain meds, that's Tylenol, aspirin, ibuprofen, all that good stuff. We've had a few calls here. You'll find posts on the Heart Failure Solutions blog that really address that they're not candy and they're not harmless. They can really cause you some real significant harm. So medicating pain with over-the-counter pain meds feels safe, and I promise you it's not. It feels harmless, and I promise you it's not. Right? Medicating with powerful narcotics to medicate pain will actually definitely increase your risk of heart failure. It will decrease your ability to be active, likely, right? If medicating your pain allows you to become more active, allows you to accelerate healing, right? If you go in for a surgery, you should medicate your pain. You should not avoid pain medication. You definitely should take it every time it's due, every 4 hours, right? Why? Because the pain of the incision will prevent you from breathing as deeply as you otherwise would. So resisting pain meds at that time is silly. We want to medicate pain when it's acute, when it's caused by an incision, an injury that's healing, right? But when pain becomes chronic, medicating with pain meds definitely contributes to heart failure, right? Because of the toxicity of the drug, because of the decreased activity from suppressing our motivation and drive, right? In a lot of different ways, pain meds contribute to heart failure. So do your due diligence to explore healing. Yeah? Become more active. Perhaps chiropractic care, perhaps acupuncture, perhaps massage could help you to resolve chronic pain so you stop drugging yourself into disease. Right? Depression. Perhaps psychotropics are a good choice for you and you should take them now to get out of your dark hole. But if you stop there, you're hurting yourself. Exploring healing beyond the drugs that suppress the symptoms is the only way to find your way back to true health, to really living a joyful existence. Right? And it's possible. Yeah? A joyful existence is possible. And that's hard to remember when you're in the deep, dark hole. Right? So pain and depression contribute to heart failure when we're not worried about heart failure. It's the farthest thing from our mind. Typically, heart failure is not on anybody's mind until they are fighting for their life. Right? Even when it's just shortness of breath, your doctor thinks you've developed asthma, you keep getting pneumonia, you're not thinking about heart failure. Right? Same as taking powerful drugs to suppress the pain. You're not thinking about the heart failure you may be contributing to. You're simply wanting to address the pain now. Yeah. Depression feels, clinical depression is not mind over matter. It's real. It's not something you can ignore and get on with life around, right? But you have to take action. Yeah? Drugging depression isn't a solution. Becoming active, expressing emotion, seeking a therapist who is your vent, the person you can gossip to till you're sick of gossiping about yourself, right? This allows expression of emotion that can hurt you, right? So think about heart failure before you need to, and you may never have to. So we're at the top of our masterminding hour. I hope that you've really begun to see that pain and depression are obstacles to overcome. Yeah? And when you meet it in your life, try to sit down with it. Yeah, it's hard to listen to someone who's in pain every day. They know people are sick of hearing it. It's hard to spend time with someone who's depressed. I want to invite you as Life Breath Club members. You're headed off into your week until you come back again for 60 more minutes of devoted time to focus on breathing. And remember that spending time with the depressed person, allowing them to be sad, is a way to heal yourself as well as them. It's a way to help them face exploring their solution. Trying to understand pain and trying to let it be okay instead of just take an aspirin, instead of getting irritated with that person that's in chronic pain, because you can't fix it. Just accept it and let them know you love them anyway. Now, this is a way to allow yourself to progress in your healing journey, as well as others, as well as supporting others on their healing journey. No problem, Chris. Head off back out to the garden, back off to work. Chris is gardening at high elevation. Chris, you don't need to worry about exercise. You don't need to worry about activity because it's built into your life. Yeah? Chris almost died waiting for a heart transplant. Chris didn't get a heart transplant and doesn't need a heart transplant. And he's active every day without thinking about it. He's grateful every moment without trying to be. And he is an inspiration for all of us. Yeah? He inspires me. Yeah. I'm still struggling with the pain in my right ear. From time to time, there's fever, fatigue. I've really been struggling with my bowel, the antibiotic drops, as well as pain medication that I've been taking to help me through this difficult part of my healing journey, has really caused my bowel some trouble. And I'll need to attend to that. We're all struggling wherever we are in our healing journey, and it's where we're at is perfect. It's how we get to the next step on the healing journey. So where we're at is perfect, right? So until we meet again next week, be kind and generous to yourself so that you can be kind and generous to others. And in doing so, we create the community that protects us from dis-ease. A loving community is a necessary part of our healing journey. So until we meet again next week, medicate pain when you need to, and explore alternatives to medicating pain. Embrace psychotropics if you need to, and remember that weaning off of psychotropics is the time they become the most dangerous. It's the time you will feel the most increase in upsetting emotion. So if you're weaning off of psychotropics, be patient. Be gentle with yourself. Reach out and ask for help. Stay with family if you feel that you need to be monitored more closely as you wean away from these mind-altering drugs. All right? Heart failure is prevented by addressing symptoms now. Yeah. And recognizing that drugging symptoms may contribute. Right? So we're dying of heart failure in epidemic proportions largely because of statins. Statins increase your risk of diabetes, which increases your risk of heart failure. Statins prevent recovery after exercise. And you know you need to be active in order to prevent heart failure. Please don't look at drugs as being preventive, even when they eliminate symptoms. So until we meet again next week, you can thrive in this life. No need to succumb to heart disease. Life Breath Club knows it's possible. Till we meet again next week, Aloha nui, everyone.